Hello and welcome to our Critics Tech channel. Yesterday, Narendra Modi government declared to set up 551 medical oxygen plants across India since the country is running out of medical oxygen. In fact, gasping for oxygen began in the first week of January this year when the Prime Minister proudly declared that India had not only defeated the pandemic but had been an inspiration for other countries. Today, India is in the ICU, and those who put her there now spend their time trying to shift the blame. The latest surge in COVID cases has driven up the demand for medical oxygen, and the demand for oxygen in hospitals have gone up by 600 to 800% over the past few days. People have made to believe that due to increased demands for liquid medical oxygen, there is a mismatch between demand and supply, which led to a shortage of medical oxygen. But there is a debatable question. The question is, does India really have a shortage of oxygen? With the rise of demands by many folds, the present demand for liquid medical oxygen in India is around 5,000 metric tons per day. During the last week, Union Health Secretary Mr. Rajesh Bhushan said that India produces 7,500 metric ton oxygen daily, out of which 6,600 metric ton is allocated to the states for medical use. Now, the question is, if supplies are to the tune of 6,600 metric ton a day and the demands are hovering around 5,000 metric ton per day, then where is the shortage? Beside this, there is an availability of a buffer stock of approximately 50,000 metric tons of liquid medical oxygen. Niti Aayog member Dr. V.K. Paul has already assured that efforts are being made to increase its supplies in the coming days. So, why are we running out of medical oxygen? It seems the issue is not necessarily stemming from a mismatch in demand and supply. Amid reports of oxygen shortage in the country, a Critics Tech looked into the issue. In today's episode, we will address several of the unanswered questions surrounding India's severe oxygen shortage. The first and foremost question is, have we done a good job of mapping demand and supply? The second most important question is, who controls the supply of liquid medical oxygen in India? Question number 3, how much is India's weak health system to blame for the lack of oxygen? Question number 4, why was there no shortage of medical oxygen during COVID-19's first wave? Question number 5, who controls the pricing of medical oxygen in India? Question number 6, is this acute shortage a design of any vested business interests? And finally, the question number 7 for today's episode, how does a severe shortage of medical oxygen help the government's coffers? We shall try to take up all the questions one by one, but let me request you to watch this video till the end. So let's start with question number 1. Have we done a good job of mapping demand and supply? The main problem is not the availability of medical oxygen. The issue is medical oxygen is not reaching hospital beds in time. The delay is a product of poor distribution network and bad planning. Most of the large plants producing medical oxygen are concentrated in eastern and western India. The densely populated areas of north and central India have limited capacities of production. States like Bihar, Uttar Pradesh, Madhya Pradesh, Rajasthan, despite their huge population, have very limited capacities to produce medical oxygen. States like Haryana and Himachal Pradesh has just one production unit each. Because of the hazardous nature, all liquid oxygen must be transported in a limited number of specialized tankers both by road and rail. It is also transported in special cylinders. Medical grade oxygen cylinders and tankers have very specific and strict protocols for storage and filling to meet the safety and purity standards. Since the production units are scattered, located at distant places, and there is a stretched distribution network, an advanced and meticulous planning was necessary to meet the challenges of increased demands for liquid medical oxygen. For example, the facilities from where Delhi has to receive oxygen now are some more than 1000 kilometers away. To fulfill Delhi's current needs, additional medical oxygen now has to be trucked from industrial zones in eastern India. This ongoing problem of acute shortage would not have happened if they had acted just 2 to 3 weeks ago. Anyway, now the question number 2. Who controls the supply of liquid medical oxygen in India? At present, the supply of medical oxygen is being allocated centrally and monitored by the empowered group called EG2. This group is headed by the Secretary in the Department of Industry and Internal Trade of the Government of India. Members of the group are nominated from all the states along with representatives from all major oxygen manufacturers. All India Industrial Gases Manufacturers Association AIIGMA, Petroleum and Safety Organization PESO, the Ministry of Road Transport and the Indian Railways all belong to this group. This group was constituted in March 2020 and states are typically allocated supplies by an interministerial group of bureaucrats. Despite the existence of a high-level working group, a scramble for oxygen among states has worsened in recent days. Unfortunately, local officials in some regions disrupted movement of tankers to keep supplies for themselves. Due to such blockades, Delhi on last Wednesday received 177 metric tons of oxygen against its allocation of 378 metric tons. Therefore, EG2 has clearly failed to augment the medical oxygen supply. The meetings and measures taken in the last few days should have been initiated months ago. If all available resources across country had been mapped and activated in time with a foolproof logistical model in place, this situation would have never occurred. People would not have died on hospital beds without oxygen supply. This actually defies the logic as to why the Prime Minister of the country should chair meetings for supply and distribution of medical oxygen, or why a chief minister should be requesting him for additional supplies in his state. This is not a subject of such escalation. Such exercise in the part of the Prime Minister cannot hide the failure of his government. Anyway, now the question number 3. How much is India's weak healthcare system to blame for the shortage of oxygen? Yes, certainly. India's weak healthcare system is also very much responsible for such acute shortage of medical oxygen. Uninterrupted supply of oxygen for the most part of India is a luxury. government hospitals don't have copper pipelines to supply oxygen seamlessly in most of the places, and therefore the only alternative is to use oxygen cylinders. The efficiency of oxygen cylinders is reduced when used for multiple patients at the same time, since the nursing staffs and health workers have to keep replacing cylinders for patients. It takes 2 people to replace 1 cylinder, and it is a laborious task. There is also a shortage of empty cylinders. In absence of empty cylinders, no one can ensure enough supply of oxygen. And unfortunately, no one in power ever thought so meticulously. Now let's look at question number 4. Why was there no shortage of medical oxygen during COVID-19's first wave? This is yet another example of India's failure rather than success in responding to the healthcare needs during the days of pandemic. Following the COVID-19 outbreak in the last year, when scarcity of medical oxygen was reported in many countries including the United States, the United Kingdom, Italy, Germany and many others, the consumption of medical oxygen in India was reduced. In 2019, the average daily requirement of medical oxygen in India was 900 metric tons, which dropped to 700 metric tons a day in 2020 during the start of the pandemic. This had happened because the number of patients treated in hospitals for all diseases went down drastically. Even surgeries were declined. Thus, the average daily demand for medical oxygen in India actually went down by 20%, which was not a success, rather a failure in the part of the government of India and its health department, including all the state governments. Now let's see question number 5. Who controls the pricing of medical oxygen in India? Unfortunately, medical oxygen in India is not a controlled commodity. However, in view of increased demand of liquid medical oxygen after the COVID-19 outbreak, the National Pharmaceutical Pricing Authority stepped in to control the prices. There have been reports that some manufacturers are charging higher to smaller hospitals who do not have annual contracts for the product. In normal times, free interstate movement is allowed for medical oxygen, but restrictions were put in place last year after the COVID-19 outbreak. So practically, there is no price control for medical oxygen in India. In this background, let's see to question number 6. Is this acute shortage a design of any vested business interests? Despite flaws in the top-level preparation and execution to ensure an uninterrupted supply of medical oxygen, the ongoing shortage serves as a reminder of scarcity marketing concepts. According to this particular marketing concept, called scarcity marketing concept, a commodity can be made scarce by reducing its supply while retaining its demand. Consumers always put a higher value on a commodity which is scarce. As a result, consumers can be charged heftily. What we see all around? Patients are being overcharged for oxygen during this severe shortage. Who is profiting from this? Aren't they the hoarders and traders? And why are they able to plunder the general public during this crisis? Who would answer this question? However, there must be a bigger game plan as well. Many industrial plants and establishments have switched to producing and supplying medical grade oxygen in the last few weeks. We will have to see if a shortage aids certain industrialists in raising prices and increasing profits. Viewers of this channel, however, may note that Reliance Industries has already upgraded its oxygen plant in Jamnagar to produce 700 metric ton a day of medical grade oxygen, which was just 100 metric ton per day previously. It will soon be raised to 1000 metric ton per day, a 10 times hike in production by the Reliance Industries. Similarly, Tata, JSW, JSPL and ArcelorMittal together now provide nearly 800 metric ton of oxygen per day to hospitals across India. So, increased production and supply of medical oxygen by the private entrepreneurs might accelerate the prices of the product, which is not under any control. However, let's now go to question number 7. How does a severe shortage of medical oxygen help the government's coffers? This is the last but definitely not the least point to be discussed in this episode. As you might be aware, the government at the center has put a 12% goods and services tax (GST) on medical oxygen. When people are in serious condition and fighting for their lives, this is nothing more than a way for the government to maximize its profits. At present, even ordinary people have been tempted to hold a cylinder of medical oxygen on hand in view of the so-called shortage. As a result, 50,000 metric tons of buffer oxygen were pumped into the market, and just consider how much more money has already been injected into the government's coffers. It's an open point to debate. However, in this episode, we have attempted to answer a number of unanswered questions. We will continue to monitor the numerous measures taken by the federal government and individual states to address the current crisis. We assume the country will emerge from its crisis soon. The misery of the common people should not be increased in any way, and the government at the center and different states must act on it. With this, let me conclude this episode. Please stay tuned. Keep watching our Critics Tech channel.